Right, thank you very much for inviting me to talk to you today. My talk concerns an assessment tool which we developed at Southmead Hospital for infants requiring continuous positive airway pressure via nasal CPAP devices and nasal high flow devices. I'm one of the sisters employed on the neonatal unit at Southmead Hospital, and I work for North Bristol NHS Trust. And the vision for the Healthcare Trust is to provide exceptional healthcare which is personally delivered. So Bristol is a major British city. It's situated in southwest England. And these slides just show us some of the various activities that we have in Bristol. We have an international balloon fiesta every year. We have the world-famous Clifton Suspension Bridge, which is over the Avon Gorge. We have an internationally renowned university, the University of Bristol, and we have the SS Great Britain. And Bristol is also the home to the creators, Nick Parks at Wallace and Gromit. So Southmead Neonatal Intensive Care Unit is a level 3 neonatal unit. We form part of NHS England's South West Peninsula neonatal network, and we provide centralised care for babies born less than 26 weeks gestation. And we will take babies from the 6 counties in southwest England, which range from the north of Gloucestershire and Wiltshire all the way down to Cornwall and the Isles of Scilly, which is sort of down here. And any baby that's born in a maternity unit with any of these 6 counties that requires specialised intensive care, we will have them in Bristol. In 2014, we had a new hospital built in at Southmead, and this is the main entrance. This is our atrium. So this talk concerns the injuries that babies can get from nasal CPAP devices and high flow devices. And nasal CPAP is the application of positive pressure to the airways of the spontaneously breathing infant throughout the respiratory cycle. And to achieve this, the baby requires a mask and binasal prongs. And high flow delivers a mixture of air and oxygen, or oxygen. It uses very small thin tubes which sit just inside the baby's nostrils, and it provides another means of non-invasive respiratory support. So the injuries, and this talk concerns the external injuries these babies can get from these devices, include lacerations to the columna. You can see clearly in slide A and slide B. A columnar notch, whereby the device has been allowed to rest up against the baby's right nostril here, and it's left a marked indentation. And columnar transection, where the device has actually gone straight through the baby's columna here. And in 2008, we had a baby that received a laceration to his columna, and from that, we developed the assessment tool to prevent injuries like this occurring again. So this is the original assessment tool that I developed at Southmead and implemented. And in 2014, we updated it, and I will go through the updated version with you later in more depth. So the injuries that these little babies can get from the devices include tissue necrosis, intranasal ulceration, granulation, vestibular stenosis, lacerations in particular to the columella, and tissue breakdown to the bridge of the nose. And now we don't tend to see so many lacerations at all to the columella, but we do see a little bit of tissue breakdown on the bridge of the baby's nose from the CPAP devices. And there you can just see the bridge and the columna, as everybody knows, is just this nice meaty area in between the nostrils. And that's where we tend to get more redness on the bridge of the baby's noses from the devices, but we haven't actually had a tissue breakdown there. So the severity of these injuries to these tiny babies includes pain, the need for reintubation, plastic surgery and readmission to hospital. And in the United Kingdom, the plastic surgeons like to, or prefer, should I say, to perform surgery on a compliant child. So they'll often wait till the child is like 2 or 3 years old before they'll bring them back into hospital to do the repair. Obviously, increased parental stress in an already very, very stressful situation, infection and sepsis requiring IV antibiotics, and therefore prolonged hospital stay, parental complaints, and litigation costs. So nasal CPAP, we have a lot of babies at Southmead that receive nasal CPAP, and between the 1st of January 2015, 351 babies received nasal CPAP. That was for that year, and the maximum length of time for one baby was 100 days. This is a type of equipment that we use to deliver CPAP. This is the infant flow CPAP machine, which is very easy to use. It has dedicated masks of sizes, and the same with the nasal prongs, and there's a template that the manufacturers give us to ensure the babies receive the correct size. It's very easy to set up, and that little mannequin shows the CPAP device set up, and you can see quite clearly there's no rubbing there at all. This little baby is receiving nasal CPAP via the CPAP machine, and he's got the prongs in situ there, and we rotate the babies between the prongs and the masks. He looks very comfortable. But you can see from this slide here, he's got the prongs in situ, how easy it is for these babies to get nasal stubbing and indentation on their cheeks and just underneath their eyes here. This is the same baby. He's looking far more comfortable there on the mask, and a lot of the babies very quickly develop a personal preference, and they quickly let us know that as well. The other device that we use to deliver CPAP is the Draeger ventilator here. It's a very nice, new, sophisticated ventilator, and it allows the baby to receive non-invasive methods of ventilation. And here he is with his Draeger interface there, looking very comfortable on the mask. So Draeger also provide masks of various sizes and prongs, and they provide a template as well to ensure the baby has the correct mask or prongs in situ. There are specific hats which are correctly measured and applied, and that's a little interface all fixed to that fits together for the baby. The other method of giving CPAP at Southmead that we use is bubble CPAP, and we use the Fisher and Paykel system here to deliver it, but we use that with the Draeger interface, as that's proven to be very effective. So we also use high flow, and between the 1st of January 2015 and the 31st of December 2015, 121 babies received high flow, and the maximum length of time for one baby was 60 days. And this was the same baby that received 100 days of CPAP, but didn't receive any injuries whatsoever to his nares. And you can see clearly from this slide that the prongs are situated just inside the baby's nostrils. They're not rubbing at all. They're not causing any indentation, and they're nicely secured to the baby's cheeks as well. So 6 months after implementing the original assessment tool, I undertook an audit, and the audit revealed that we had 100% documented compliance with the assessment tool. The incidence of nasal injuries was now very minimal, and we could say that we had a structural formal mechanism in place. There was a formal strategy in place looking to see and looking to prevent nasal injuries. I've published 2 articles relating to the assessment tool that I developed at Southmead, and prior to publishing the articles, I undertook an extensive literature search looking at assessment tools for babies receiving nasal CPAP or high flow. And within the literature search that I did, I found multiple studies which had undertaken small randomized controlled trials within their own neonatal units, looking to see which device would cause the least injuries. And certainly these 3 authors, that Fisher, Young, and Alsop, Cook, and Gupta, have all developed assessment tools which they now use within their units. So those are the references for the 2 articles I've written. So the assessment tool that we've developed at Southmead allows assessment of either device at any time, and it therefore promotes improvement and innovation along the neonates pathway. In 2008, the Cochrane collaboration reviewed a lot of the data concerning nasal injuries from CPAP devices, And they note that attention needs to be directed at determining which device is least traumatic to the infant's nose. And for implications for future research, they note that these studies should include studies comparing nasal devices should ensure that the prescribed starting pressure at the nasal level is the same and that sufficient flow to meet inspiratory demands is the same in each treatment arm. And none of the articles that I read and inquired from before in doing my literature search had actually taken this into consideration. So this is our current score chart, and I will take you through this now step by step. There are 3 scores to the score chart. A score of 0, the nares appear very healthy and no action is required. And our intensive care charts are set up so that on an hourly basis, the nurse can write the nasal score down so that we have a continual flow. A score of 1, there's slight redness noted around the nares. The area appears painful to touch with some indentation noted. And the action that we would expect the nurse to take at this time would be to go back, ensure the baby's wearing the correct size hat, mask or prongs, as per the neonatal guidelines and as per the manufacturer's recommendation. To assess, discuss with the senior nurse or medical team whether to change from mask or prongs or to consider a change of device, so maybe moving from bubble CPAP to nasal CPAP via the CPAP machine. And obviously to document this on the intensive care chart and in the notes. With a score of 2, there would be marked indentation. The area would be painful to touch with tissue breakdown. And the immediate action we would expect the nurse to take would be to call for help, to call a senior nurse or medical staff, to remove the mask or prongs immediately and support the baby's breathing via the near-puff and PEEP, and provide an alternative respiratory support, and that may include re-intubating the baby. Obviously, to document this on the intensive care chart and in the notes. To complete an EAMS form, and EAMS stands for Electronic Accident Incident and Management Systems, which are our risk management forms and therefore form part of our clinical governance strategy. To refer the baby to the plastic surgeons and medical photography as necessary. And obviously at this point we would call the parents in, explain to them what's happened, because this is an iatrogenic injury. There is also a visual guide available in all the intensive care and high dependency rooms on the unit, and it allows the nurses to compare the score chart that the score she's giving the baby with the score chart. And Paliotel in 2003 note that CPAP devices have the potential to cause nasal excoriation and scarring if they're inappropriately applied or infrequently monitored. And therefore, to prevent nasal scarring and excoriation, the nasal CPAP assessment tool was introduced within the neonatal unit at Southmead, and it's since been updated, and it now includes babies that receive high-flow oxygen. And Huffins in 1997, which Dolac updated in 2013, note that using an instrument to predict and thus prevent skin breakdown could decrease costs associated with prolonged hospital stays in neonates. So the best practice nursing care that we have developed to prevent these nasal injuries from occurring is the education and training of the multidisciplinary team. We have a dedicated respiratory team. We don't have respiratory therapists in the UK like I know you do in the States and in Canada, but the respiratory team comprises nurses and senior doctors, senior physicians that look at and review the policies and procedures regarding respiratory care. We have a very thorough documentation program in place. We have dedicated care plans for babies receiving high flow and nasal CPAP, and we have nursing competencies which form part of the NHS toolkit regarding neonatal care. And as I've mentioned, risk management is enhanced through completing an EAMS form if necessary. So my proposal to you today is that you take this back to your neonatal units, or you ask the managers from your neonatal units to contact us if you're having babies that are receiving nasal injuries. And I do this because the assessment tool allows a focused examination, is well organized, it's effective, it's very easy to audit, It involves minimal cost in implementing it. It minimises stress and avoids pain to very vulnerable babies, and it therefore improves quality of care to them and their outcome. It's very sensitive and it's individualised. So the assessment tool has proven to us that it's a clinical intervention tool, and it makes a lifelong difference to babies that receive nasal CPAP or high flow, regardless of their gestational age. And this is our outcome. This little baby received 49 days of continuous CPAP whilst at Southmead. He was born at 26 weeks gestation. He's got no injuries whatsoever to his nostrils or to the bridge of his nose. His mother sent me this photograph the day that he came off his low flow oxygen. So you can just see he's got a little bit of sunburn. You can see the whiteness from the low flow cannula there. And the future plans then for the unit include that we will re-audit the tool. We will include the baby's cheeks in the assessment tool because that's where we do tend to see some indentation now. We provide ongoing and education to the multidisciplinary team, and other units within the UK are approaching us about implementing the assessment tool, so we are liaising with them. And hopefully to participate in multi-centre randomised controlled trials which will encompass and embrace the recommendations and implications that the Cochrane collaboration have recommended. And as you so very kindly invited me here, we'd like to reciprocate the invite, and you're all welcome to visit Southmead if you come to the UK.
Is the revised tool in one of your articles?
Yes, it is, yes.
Which one?
It's in both of the articles, if I go back to the references. That's the current score chart, okay? And those are my two references. I published it in Infant first and then in the Journal of Neonatal Nursing. That's where they are. Do you have any other questions? Hello?
Do you know if anybody's using a similar tool for adults? Because a lot of the geriatric patients tend to have irritations also from the mask, from the nasal cannulas, and they develop sores.
Yeah.
And I wonder if there's anything similar for adults that you've heard of.
I haven't, because I've been a neonatal nurse for a very long time, so everything we've done is centered around neonates. But I'm sure that this could be adapted very easily.
Right. That's what I was thinking, because it's very important, because some of them, all of a sudden their ears, their nose, their face.
Yeah.
Okay, thank you.